And we have Senator Josh Kimbrell in the audience with us today. Out of senatorial courtesy, we're going to ask you, Senator Kimbrell, you wanted to say a few words to address this subcommittee, and I'd like for you to step forward now. And while you're coming to the podium, I do want to say a brief moment. Last week, we heard from folks who've dealt with situations with loved ones or their personal experiences in dealing with COVID and getting treatment. We wanted to hear from all of those folks last week. This week, we're going to hear from DHEC, medical professionals, hospitals, other doctors from that standpoint of how we're dealing with COVID and how we're getting treatments to the constituents that we represent. So appreciate everybody's patience and realizing why we wanted to break it up into two groups. And also, just for everybody's knowledge, on the 29th, the same time, I have this room reserved, but it'll be at the call of the chair whether or not we have another subcommittee meeting. So I wanted to let everybody know that. So anyway, Senator Kimbrell, thank you for being with us.
Mr. Chairman, thank you, and members of the subcommittee, thank you for the chance to speak to you. Mr. Chairman Verdon of the Full Medical Affairs, y'all are the busiest committee in the Senate this year, I think. And it's good to see everybody again, although unfortunately not under great circumstances as we're dealing with the new surge of COVID, Delta variant and other mutations or variants of the virus that may be coming down the pike. I wanted to take just a moment, and Mr. Chairman, of course, you and I represent the same county. Part of your district is Spartanburg County. Of course, my entire district is Spartanburg County. And we have seen a significant surge in Spartanburg and a significant rate of transmission of this new Delta variant. And the response, I think, has been a little discouraging. So that's why I'm here today to speak on behalf of many of my constituents with whom I've worked directly. My office has worked directly over the past few weeks and months and share with you our kind of observations and what I think, hopefully, together as a Senate, we can do better. You know, I've heard before that, I've never seen a virus this politicized, right or left. We've never seen a response to a virus in my lifetime, at least, this politically driven. And I think that's unfortunate because we start to miss what works and doesn't work in the name of politics on both sides of the political spectrum. And I'm not here to add fuel to that fire, but just simply to tell you what we've witnessed back home. We've heard this largely described as a war on COVID, fighting a war, fighting a battle. And if that's true, then I hate to say I think it's become a lot like Vietnam in terms of the quagmire that it's now become. And largely for the same reason, because it's being driven, the response unfortunately is not driven by doctors on the front line as much as it is by bureaucrats, by agencies, and by folks who have less experience on the front line than they do working in an agency. Let me give you an example so it's real world and I'm not just talking theoretical. The number 2 guy at my company, I'm CEO of a private company back home, and my number 2 guy, my right-hand guy, he and his wife both moved here from California last year, and they're healthy, young, mid-30s folks, and they contracted the Delta variant back around Labor Day. And it's been a saga ever since then. It's been a very difficult situation for them to get adequate treatment. So they came to, of course, knowing me as a coworker and as a friend, came to me and said, hey, look, can you reach out to somebody and get us some help? Because they could not get any kind of immediate treatment and their condition continued to worsen. The wife particularly developed viral pneumonia, and we reached out to a local clinic, Mr. Chairman, in your neck of the woods, and we asked for monoclonal antibody treatment, the Regeneron treatment that was scheduled, but because of a bottleneck coming out of DHHS, there was a 72-hour delay before they could get in from the time we called about an appointment. And during that period of time, the wife's condition began to deteriorate to the point that she went to the hospital in Spartanburg and went into the emergency room, and then things really, truly began to spiral. She was diagnosed, and she forwarded to my office copies of the diagnosis with viral pneumonia. They said that she could be admitted and put into a bed, and they could do the BiPAP or things of that nature. She didn't want that. She didn't want to be admitted. She didn't want to stay, so she said, I'm going to leave. Can you do anything for me? She was sent away from the hospital without even so much as a prescription. Her office, she called my office and said, can you do anything? We literally had to call a medical college to get her into a private practice so she could get a prescription for antibiotics for a diagnosis of viral pneumonia. I find that to be truly amazing. And then a few days later, she was able to go and get the monoclonal treatment from Regeneron, which ultimately began to reverse her conditions, and she is now better. She no longer has COVID. Her and her husband both now are COVID negative, and the symptoms of viral pneumonia are being remedied by virtue of the prescription she was provided by a family practice physician. And that shouldn't happen. But I feel like it goes back to the idea that the protocol is being driven by bureaucrats and by a prescription, no pun intended, from folks at the national or state agency level. And in reality, the doctor should be able to make that decision on his or her own and what's best for that patient in that moment. And I believe here in South Carolina, we've had debates even in the last session about expanding right to try legislation, about giving doctors freedom to make decisions. And I believe we need to continue to push for that because in addition, another family I represent, and this will be the last story of this, lost 2 family members back to back. One was a 36-year-old former high school classmate of mine, and one was his father. So a mother lost her son and her husband in 2 weeks. The dad they were begging for them to try anything other than just putting him on a ventilator. No one would hear those cries, even though the family said, we'll sign a medical waiver. We'll get a lawyer to sign a waiver. Just give us something, an alternative. Give us ivermectin or hydroxychloroquine or anything you can try because he's going to die anyways. Nobody would hear of it, and he was put on a ventilator, and he is now deceased. Ladies and gentlemen, I respect our frontline doctors. I respect our clinicians who are doing the best they can under difficult circumstances. But I think it is incumbent upon us to ensure that they are given the ability to try what's necessary in circumstances, not just be prescribed a course of treatment by the CDC or even just by DHEC. And I also believe, at least in my neck of the woods, and Mr. Chairman, I'm sure you've experienced this also, the most effective treatment we've seen with folks, even who have been vaccinated, and I'm not one of these folks out there advocating against the vaccine, I've personally taken it, but that can't be the only solution. And even folks I know who've been vaccinated have gotten sick, and the only thing that's reversed their symptoms has been the monoclonal antibody treatment, otherwise known as Regeneron, at least in our neck of the woods. And Florida's had to go around DHHS to go direct to the manufacturer to get supplies of that. I understand we have the similar choke point here in South Carolina. And I certainly hope we'll look at not only expanding the right of doctors to do what they need to do for their patients, to pull back the bureaucratic layers, but also to improve access to those life-saving treatments that are being bottlenecked out of Washington. So I appreciate your work. I appreciate the work of this committee, and thanks for the chance to address you today.
Thank you, Senator Kimbrell. There's going to be a question for you, if you'll stay there.
Okay.
I did want to recognize, I mentioned Senator McLeod earlier, but she is with us virtually. So, Senator McLeod, thank you, along with Senator Kempson, once again, for being with us. Senator Davis, you have a question?
I do. An observation more than a question, but Senator Kimbrell, I appreciate the way you frame this issue. Absent from your presentation was any discussion of the relative merits between vaccines and therapeutics, and more toward empowering doctors, empowering patients, and recognizing that we're in a fluid situation where medical norms may change, as we've seen it change in regard to Regeneron. I mean, it wasn't so long ago that it was being discouraged or discredited, and now we have the federal government rationing it because it's in such demand. So I think you're exactly right that we go down rabbit holes when we start to try to pit therapies against each other, against the vaccine, and I think we're on the better track when we talk about the physician-patient relationship and empowering physicians and empowering patients to an extent that they may not be empowered right now. There may be institutional pressures, whether it comes from a DHEC or the CDC or insurance companies or any number of institutions may exhibit pressures or biases that take away from what I consider to be the primacy of that relationship. Is that what you're getting at here? Is that recognizing that the fundamental building block upon which public health ought to be founded is between the doctor and that patient? And I've made this case in the past in regard to medical marijuana. I mean, you've got the FDA, you've got various federal agencies that say you can't use it. You got the South Carolina Medical Association saying you can't use it. And the argument that I've made, and I think it's the argument you're making, is that institutions ought not trump that individual relationship between a physician and a patient. Is that a fair characterization of what you're saying?
Senator Davis, that's a perfect characterization of what I'm saying. And to your point, this notion of institutions trumping the primacy of that doctor-patient relationship is exactly the problem. I have many constituents. This is probably the number one issue I'm getting phone calls and emails about in my office. That's probably true for you and many members of this body. And a lot of my constituents back home are no longer going to the hospital. They won't go to the network because they're afraid that their voice won't be heard and what they're asking for in dire circumstances will be ignored. And that's even to the example I gave of the young lady who chose not to be admitted and was sent home without a prescription, and then we had to send her to another primary care doctor out of network just to get a prescription for antibiotics. That shouldn't happen. I think that's exactly to your point. The doctor-patient relationship is primary and should be prioritized in this medical crisis.
I thank you for that, Senator Kimbrell. Appreciate you bringing it this way. Senator from Orangeburg, Senator Hutto, and then I believe I hear Senator Kempson. We'll come to you next, Senator Kempson.
Thank you. Senator, I was listening and I think heard the outcomes, but where was it that the doctor was not allowed to do what the doctor wanted to do?
Well, I can't say what I don't know what the doctor's decision was, so I don't want to sit here and say that the doctor wasn't allowed to do what he or she wanted to do. I'm saying what the patient was not allowed to do.
I know, but what you're advocating is that the doctors be able to prescribe and do what they think is in their patient's best interest, but I didn't hear in your story where that didn't happen.
Well, I've had numerous doctors make that claim to me and call me about it. I'm not going to divulge their names or the facility for which they work right now out of fear of retribution. They were intentional in saying, please don't use my name. But there's a large number of doctors with whom I've spoken back home who've had that concern.
Okay.
Senator from Orangeburg, if I can also segue on that, because I'm also represent Spartanburg County. I've had a couple of doctors reach out to me as well, stating that they have been warned if they speak to us or speak out that there's going to be consequences. So I can't, I know that seems weird, but
aren't doctors like among the most powerful people in our society? And you telling me that they don't want to speak to us? How are we going to address their problems if they're not going to tell us what the problem is?
They don't mind speaking to us, but they don't want their names shared. I think that's the point he's getting at. But I think you'll see.
Well, my only point to him was it sounded like unfortunate situations that eventually got dealt with, but I didn't hear where the doctor couldn't do what the doctor wanted to do.
Well, Mr. Chairman, may I address that a little more
Senator
specifically?
Kimbrell.
So, Senator, one conversation I had yesterday, again, the name will be left out, it had a private independent practice, later became affiliated with the network, was openly told by a member of their staff that DHEC had flagged them for prescribing medications they didn't think should be part of the typical regimen for treating COVID, was concerned about the potential loss of their practice relationship, having their contract suspended for making decisions on a case-by-case basis that may not agree with the orthodoxy prescribed by the agency, and was even concerned about the status of their medical license. That was a conversation I literally had last evening.
Thank you. Senator Kempson from Charleston.
Yeah, first of all, Mr. Chairman, let me thank you and applaud you for convening the Medical Affairs Subcommittee, and to Chairman Verdon as well. I think it's very important that we hear some responses to these questions from the hospital CEOs and the doctors. So I'm not going to take much time. I just did have one question for Senator, the senator. Were in any of those cases you mentioned, were any of those constituents you represent, were they vaccinated?
Yes.
So these were vaccinated individuals who had to check into the hospital because they later contracted COVID.
Not in every case, but in several instances, yes. And they still contracted the Delta variant and still had significant symptoms.
I'm talking about the cases you mentioned today.
Yes, one was and one was not.
Okay, all right. Thank you.
Thank you.
Thank you, Mr.
Senator
Chairman.
Kimbrell, I appreciate it. Next up is going to be Dr. Annie Andrews from MUSC.